I did concept maps for all 4 phases for the AI assignment. So starting with the oral prep phase, I included the different structures, the lips, teeth, tongue, soft and hard palate. The velopharyngeal port is patent. The functional purpose is that it's the containment station, so it contains and prepares the bolus. Then the cranial nerves involved are 5, 7, 10, and 12, and I put their functions there. And then the impairments, risk of aspiration, poor bolus control, food scattered, and prolonged chewing due to fatigue. Next, I have the oral transit phase. So the velopharyngeal closure. Then I have the different muscles in the structures. So the levator veli palatini and the superior pharyngeal constrictor. The A and P rolling motion of the tongue to create the ramp for the bolus to go down. Propel the bolus to the pharynx. The velum and the posterior pharyngeal wall are part of that. And then the different cranial nerves involved, 5 and 10. And then impairments are nasal regurgitation or multiple swallows due to the inability to form the bolus properly. And then next I have the pharyngeal phase. So I put the 4 more important things that happen in this stage. So the hyolaryngeal elevation, the cranial nerves involved in that stage, 5 and 7. Yes. And then the different impairments that can happen if this specific part of the swallow is disrupted. The closure of the larynx happens from the hyolaryngeal elevation, and we have an apneic event. And then the cranial nerves involved in this with the larynx, so 5, 10, and 12. And then the different impairments that can happen if the larynx does not close. Then we have the cricopharyngeal opening, in which the cricopharyngeal muscle relaxes and the upper esophageal sphincter opens. The cranial nerves involved with that, 9 and 10, and then the different impairments that can happen if that relaxation of the UES does not occur. And then I have the tongue, base of tongue and posterior pharyngeal wall, the cranial nerves involved in that, and then the impairments that can happen if that contact doesn't meet between the two. And then lastly, I have the esophageal phase. The parts of this the bolus goes from the UES to the LES, in which peristalsis occurs. And then I put the different muscles and cranial nerves involved in each of the stages, and then impairments that can happen if this doesn't properly flow together, like aspiration, esophageal spasms, gastroesophageal reflux disease. Did I say aspiration? And then residue in the piriform sinuses.